Growing trend in Hollywood and white-collar America, plastic surgery. Jessica Simpson and her sister Ashley have both done it, as well as many other young Hollywood stars. But the question this morning is, why? What's the appeal?
Joining us this morning is therapist Dr. Laura Berman and Dr. Greg Wiener, Resurrection Hospital, and you guys are going to help us shed some light on this issue.
Absolutely.
Tell us, why are we seeing this increase in number of plastic surgeries? Why do you think?
Well, I think part of it is that it's just become so normalized, and everywhere you see, and in all the magazines that all the women read, this one is getting this done, that one is getting that done. Their friends, the shows out on network television like Extreme Makeover and the like makes it seem very accessible, very normal, and also I think our standards and expectations of what beauty is and how people are supposed to look like is really starting to change.
Well, Dr. Wiener, one of the things that is painfully obvious, especially with somebody like Jessica Simpson, who we consider young and already so beautiful, why so young? Why are they choosing plastic surgery?
Well, number one's right. I think that everyone wants to change some aspect of their appearance, and so that's the first one. But also in my practice, I'm seeing a lot of younger women who are doing this because it's easy. There's less invasive options. I can offer less invasive options that allow women to do things without a lot of downtime and without a lot of recovery.
And much more affordable, we hear
Absolutely.
as well.
Yes.
So any tips out there if you're considering getting plastic surgery? What can you do? What should you be thinking about?
Well, number one, you have to go to a board-certified plastic surgeon that's certified by the American Board of Plastic Surgery, number one. And also that you need to go to a plastic surgeon who does the procedure a lot.
And any other things that we can
Well, discuss expectations
about?
is up there, and I think that's a really important one.
A very big one. In my practice, I basically open a very clear line of communication with each patient, establish a relationship essentially, and make sure they understand the risks and the limitations of every procedure.
Are you ever afraid that someone might be expecting more than is realistically possible?
Absolutely. People do it all the time, and you've got to manage those expectations and be very honest with every patient about the limitations of their surgery.
Well, you know, I was reading an article, Dr. Berman, this question is for you, and in it there were a plethora of patients who had had so many surgeries and spent so much money, and I'm looking at the pictures and I'm thinking, oh my gosh, you really look crazy.
Yeah.
At some point, isn't it really just
It's a
too
slippery
much?
slope, and there is, you know, clinicians, and you'll hear this among the therapeutic community, are starting to coin this term about plastic surgery addicts, which isn't a formal psychological term, but basically you're seeing this trend where people can't get enough, and they get a nose job done, and then they need a chin job, and they need a cleft put in, and then they need breast implants and liposuction, and it's never ending. And there's also a trend toward really beautiful people who start off really what our society would consider very attractive,
Yes.
still getting more plastic surgery. And usually both of those cases, it's because they're using the surgery to kind of fill up an empty place inside themselves, either low self-esteem or a destructive relationship. They're looking for the surgery to fix what's broken inside of them rather than enhance what's on the outside.
And that's a problem, right? I mean, that is something we should think about and consider.
Absolutely, and I've talked to Dr. Wiener about this before, that he really does, you know, and I think it's really something that most surgeons should do, and unfortunately don't, that he really does talk to patients about what the reasons why they're getting this surgery, not only their expectations about how they're going to look, but their expectations of how their life is going to change after they get that surgery. And I think that that is a question that you really need to ask yourself.
Well,
Dr.
thank you,
Berman,
Dr.
Dr.
Berman.
Wiener.
Thank you
guys.
so
Thank
much
you.
for
This
joining us
morning.
today. And at some point you say enough is enough.
Absolutely.
Thank you very
you.
much for joining us
Thank
today.
you very much.